Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello, everyone. This is Dr. Thomas Grove. This is Living Pain-Free. Welcome, everybody. Today, we're here to talk about your musculoskeletal issues, your orthopedic issues, things that might cause some pain, some aches. Dr. Darrow's away from us here this week, but we're very excited to talk to you about how regenerative medicine, right, using things like platelets, stem cells, the healing cells of the body, to try to get some healing going, right? Keep you out of that operating room, keep you back in the game. Major issue we have today is things like chronic pain, right? So if pain's a big issue and it's a limiting factor for you to become active, live the best life that you can. Keep your energy levels up. Keep your sleep with good quality, right? Get you out there and put good out in the world, right? Regenerative medicine can be an amazing tool that's very non-invasive, very safe, very quick recovery compared to things like surgery. It might be a real option for you. So we're here to talk about that today. We'd love to give you guys the opportunity to talk to us here live in the studio. You can give us a call. Our number here is 866-870-5752. That's 866-870-5752. We've got a lot of great free gifts for you, right? First of all, we've got our book here from Dr. Darrow, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a fantastic place to start. Very easy read to give you some good introductory information, some great stories and case studies. We've got a lot of great formal studies in that book as well, over 200 studies in that book. We'll send that to you for free. We even pay the postage. So if someone that you know, yourself, a loved one, a guy that you meet at the gas station, anybody, right? We'll get that book sent out to them and get them started on their healing journey. So really what we're talking about is, do we need to have surgery nowadays? So it's a totally different culture, big shift that's happening in the world of sports medicine and musculoskeletal medicine, orthopedics, where we're looking at trying to keep people out of that operating room. So certainly, right, you get in a car accident, you have a big injury, you got, bones fractured and you've got major instability, things like that. Surgery, of course, is a great option for you. I've spent thousands and thousands of hours in the operating room, have the utmost respect for our surgeons. It's a very difficult job to do, very tall order to try to, cut skin, and we're replacing joints, trying to avoid things like infection, using things like anesthesia, which can be dangerous, right? And anytime that you're doing those sort of surgeries, long recovery time. So it's a very tall order. We want to make sure that's the last option for you and not the first option, right? So lots of experience in the operating room, lots of experience in the field, being a team physician for Division I colleges, seeing thousands and thousands of patients. I've traveled the world trying to find the best training, the best hands, the best eyes, trying to figure out what are the best techniques that we can use to keep people out of that operating room, right? And get them back in the game, get them back to work as soon as we can. We'd like to give you an opportunity, too, to get a free consultation over the phone with our staff. Now, not with Dr. Darrow and I, but with our staff. That number to call is 800-300-9300. That's 800-300-9300. Want to make sure we're giving you an opportunity to get healed, right? Check out our website as well. There's a spot on every single page to send us an email. We check emails day and night, making sure that we can get you in a position to heal. Our website is www.jointrehab.com. That's www.jointrehab.com. Website's really good, really well put together. Find out a little about Dr. Darrow and I, find out a little bit about what these procedures actually entail. We've got lots of great videos on there as well. I'll try to take the fear out of what these procedures are like. Every single week someone comes in and they're very needle phobic, right? They're terrified of needles, and they get done with the procedure and they're always saying, hey, that wasn't so bad. I don't know why I was so worried about it, right? So a couple reasons for that. So when we do injections in the clinic, what I use is ultrasound. So not the ultrasound that you use to, heat some things up. We use it as our eyes. It's a great imaging way to actually look at that tissue in real time. So not only can I diagnose with it, right? I can look at the tissue, see if there's maybe some tears or some inflammation or some arthritis, a fluid collection perhaps. Then I can take that information, use that as a part of my physical exam, right? Putting your hands on somebody, making sure we're stressing those tissues, trying to reproduce that pain. That way we can verify where that pain is coming from. And then if we decide to go ahead with treatment, what we can do is use that ultrasound to help guide that needle. So very, very important that if you guys are thinking about doing a regenerative medicine treatment, that you're going to a physician that has training in this stuff. I don't want to hear about someone who had a weekend course, right? Someone who's got years and years of training. Again, ideally, they're fellowship trained in this kind of stuff where they can get the proper experience to inject you in a safe way. Which also lends itself to having the injections be pretty comfortable for you. So when you use ultrasound, I can use a really small needle, smaller than a flu shot needle, if you can believe it. We can really be specific where we aim that needle. All right, so it's important to put those cells on target. A huge challenge that we have is trying to figure out where someone's pain is coming from. So we speak about it every week, but it's very important that when you come into the clinic, you leave your diagnosis at the door. Right? So a lot of times people will come in and they'll have an MRI or maybe an X-ray that might show, some pathology, right? So if it's a lumbar MRI, for example, I'm telling you, it's almost every single patient has degenerative disc disease, maybe some facet joint arthritis, again, little joints in the spine bones that can have a little arthritis in there. They might even have a disc bulge or a disc herniation, right? These are very, very common things that we see. Same thing with in the shoulder. Maybe we have a little rotator cuff tear. And then any joint, right, where two bones are meeting and gliding over one another, that's a joint, right? The knee joint, the hip joint, for example, and that can have some arthritis in it, meaning the articular cartilage, right? That tissue that provides a little lubrication, allows those joints to move smoothly and freely, might be thinned out a little bit, right? So we see these findings, right? The pathology. But the question is that the reality? Is that actually what the patients are experiencing in terms of their discomfort or whatever their symptoms are? And so that's a very tall order to make sure that we're lining up those two pictures, right? Look at your imaging, right? Is that making sense compared to what I'm seeing on the physical exam and what the patient is telling me? Very kind of an interesting case I had this week. Someone came in, they had an old L2, right, lumbar, second vertebra, it's kind of in the lower back, had an old compression fracture. So they came in saying, hey, I've got a compression fracture of one of my backbones. We got to get this thing treated. And certainly, right, compression fracture can be something that causes pain for somebody. But this is something that when I was looking at the timeline didn't quite make a whole lot of sense. This is somebody who had, an MRI over a year ago, and even at that time they were thinking, well, this is probably an old fracture. But they did have some back discomfort. So again, it's reasonable to think, oh, well, if you have a compression fracture, right, that's where your pain's coming from. However, when you do the physical exam, their pain wasn't anywhere near that L2 vertebra, right? So this is somebody who was considering a surgery to address this issue, that, had they have gone for an L2 surgery, right, they can go in and try to give some more stability, or they take out bone fragments, or they'll go in and just explore that area. I'm very confident that would have got them no relief. Most likely they would have had more discomfort after that surgery. In this case, it was something called the iliolumbar ligament. So what this is, it's a ligament, which is a piece of tissue that helps connect a bone to another bone. We've got some on both sides of our back, right? So they connect the lumbar, the lower back bones, to the ilium, which is kind of those pelvic bones off to the side, right? Again, I don't know what the reason is, but the things that we see in this clinic, that is like the most common cause of pain that we see. I know we're talking in some different terms here, but this is just a sprained back. I don't know if you guys have ever, took a funny step off a curb, maybe sprained your ankle. It's the same idea, right? You've got ligaments that help provide structural support and stability across joints. That's how our body is put together. So same thing happens in the lower back. So, this is something that is very, very important to determine is, do we have somebody who's got a true pathology that lines up with the reality on their imaging, or is this something that a physical exam can tease out, right? Every time that I have a patient come in and they're considering a surgery, I always like to ask them, did their physician put hands on you when they're coming up with their care plan? And it would shock you how many times that they go in and they have a surgery scheduled, a surgery planned out, and their doctor did not put hands on them, right? Now, you might be thinking that's not a big deal, but having an unnecessary surgery, it doesn't sit well with us, right? Because surgery have complication rates, and we want to try to make sure that we're putting you in a position to be conservative first, and then we get more invasive only if we need to. We'd rather not subject you to those sort of complications if we don't absolutely need to, right? So for a surgery, you're looking at a pretty good recovery time, right? Especially things like, your joint replacements, or maybe you have a anterior cruciate ligament or an ACL reconstruction. These are things that take time to heal, right? So people think, oh, well, I'm just going to go in quick and get this surgery. And again, the surgery might not last that long, right? Certainly there's a lot of orthopedic surgeries that we can do within an hour or two that can still be very invasive and require a very long recovery time. And what we're looking to do here is just take a peek at the non-operative side of things. Is there something more conservative that we can do? Is this an injury or a symptom that we can just rest and it gets better on its own with very little risk of any sort of complication rate? Again, what we do here with regenerative medicine is using the healing cells of the body to supercharge that healing process and speed you along, right? Hopefully keep you out of that operating room. As we're talking here, guys, I want to give you an opportunity here, too, to call live in the studio, again, to talk with us. Our phone number to call us here is 866-870-5752. That's 866-870-5752. Again, we can chat with you live. Love to talk about yourself, right? If you've got a loved one, use a fake name if you need to. If you're driving, make sure you're being safe and pulling over before you're chatting with us. Again, you can give us a call for a free consultation over the phone with our staff, not with Dr. Darrow and I, but with our staff. You can give us a shout. We're at 800-300-9300. That's 800-300-9300. If you're super shy and you want to give us an email, check out our website. There's a spot on every page to shoot us an email. We respond every day, morning and night, making sure we're putting you in a position that we can get you some information, get you some help, point you in the right direction. Our website's www.jointrehab.com. That's www.jointrehab.com. Good videos, good studies. It's a great opportunity to educate yourself and try to get some more information to see if regenerative medicine might be a good option for you. Again, the idea is we're using the healing cells of the body to try to heal some tissue, right? Keep you out of the operating room, get you back to work, get you back to a life where hopefully we can decrease some pain, get you some more functionality out of it without having to go underneath the knife, right? And we utilize a couple of different cell types to heal that tissue. So one option is something called PRP. That stands for platelet-rich plasma. So here's the deal with that one. You do a blood draw like you're giving a blood test. Now we take that blood, and what we do is we concentrate down all those good growth factors, those healing factors, and your platelets, which we found to play a very important role in healing. And what we do is we concentrate those down. We leave behind the red blood cells. The way that we do that is we spin the blood down really fast in a machine called a centrifuge. What that does is separates out all those blood components. From there, we can leave behind the red blood cells and have a good concentration of those growth factors and platelets. It's actually kind of yellow or sort of clearish in color compared to your blood, obviously, which is red. So we're removing those red blood cells. Every week someone's a little surprised. I always show them the syringe of what we're about to inject there, and they're like, "Is that my blood? What happened to the red color?" Right? So we're leaving behind those red blood cells and just focusing on those healing factors. Right? PRP, it's amazing. It's very, very good. We found that something that works even better is something called stem cells. So these are some of the amazing cells in our body that are responsible for a really quick boosted effect to healing. We've got stem cells all over our body. These are the cells that we think are responsible for a lot of the healing qualities, right? You can kind of think of these as directors. They kind of direct the healing show. The way that we can get some stem cells from you is doing something called a bone marrow aspiration. So what does that do? That is where we numb up the back of the pelvis, right? We use a small small needle and we insert it into the bone. I know it sounds bad, but we numb you up good first, right? So, put that needle into the bone. We pull out some of that bone marrow, which has both platelets and stem cells and good growth factors there. We can take that substance down and direct that under ultrasound guidance. Again, ultrasound, those are my eyes. I can actually see the tissue in real time. You can watch the screen as I'm doing the injections. I always encourage everybody to do that. Pretty neat. I always see eyes light up every week because it's not every day you can actually see your tissue in real time. And again, we can point out exactly where we think the issue is going on. And it kind of connects those dots. I was always frustrated when patients get an imaging test done, but they don't actually see the results. Maybe it takes them a couple of weeks or longer to get those results back. The amazing thing with ultrasound that I have training in, lots of training now, is that we bring you into the clinic and that can actually scan you real time. They're right in the office, right next to me. So as we're talking, I can throw that ultrasound on. I can show you what your tissue looks like in real time to help diagnose, but also to help me guide that needle in on target. Right, so it's a very non-invasive way to treat any sort of muscle strains, arthritis. Maybe you have a tendinopathy. And the cool thing about this stuff is because I can look to see where that needle's going, I can inject pretty much head to toe, right? So if you've got TMJ in the jaw, if you've got, cervical spine, upper neck pain, any sort of joint, shoulder, hip, ankle, knee, any of those little joints in the fingers and toes. We can get to all those areas now using ultrasound, being very, very specific. So it does a couple of things that allows me to be very accurate, right? We're giving you the best chance for these injections that give you some relief. In addition to that, it makes it a little more comfortable for you, right? If you're not quite sure where you're going with that needle and you're dinging up good, healthy tissue, not only is it going to take a little bit longer to do, and maybe it might not get you the best results, it's going to hurt you, right? So we want to make sure we put you in a position where you're as comfortable as possible. Again, people who have true needle phobias, we treat those people every single day. Again, making sure that we're using very small needles. We can use a little local numbing to get you more comfortable beforehand. So it's a much less scary process than people think it is after they get done with it, right? And again, great place to start is checking out our website, www.jointrehab.com. We've got a lot of great videos on there as well. You can actually see us doing these injections. No one's jumping off the table by any means. So it's a very non-invasive way to treat these sort of symptoms, right? Now, how this stuff works is after we inject these cells, right? Platelets, stem cells, the healing cells of the body, what your body does is launch a little immune response where we get a little inflammation, right? You might be thinking, oh, inflammation is bad. No, we like inflammation. It's the important factor that actually jumpstarts that healing process. So the cells are in there. You get a little inflamed. What does that mean for you? Well, you might have a little stiffness, maybe a little soreness here for a day or two. That's the majority of our patients. At that point, what we want you to do is after a brief period of offloading, right? I want you to go on and run a marathon after we inject your knees. So we certainly have patients who do that, but not ideal, right? What we end up seeing is that the tissue will actually heal on a cellular level. We've got a lot of great studies now using microscopes. We can actually see the cells involved, right? We've got fibroblasts laying down collagen. We've got all these great healing cells that are actually laying down what we call immature tissue that when you give it rest, give it a little time, can firm up and become mature tissue. We can think of it like when you go and you put some grass seed down, you don't go and stomp on it right away, right? You let that grass get nice and healthy before you can go step on it. Same idea, gets a little bit of time, right? Sometimes you need a couple of rounds of treatment. It's definitely a tough part of my job is I wish I could tell you exactly what day, right? How many weeks, it could be months, before you're feeling back to being in action. Everyone's a little bit different, right? So we always say we just do one round of injections at a time, right? So how many injections is it going to take? When am I going to feel better? Unfortunately, I wish I can guarantee you, but everyone's healing journey is a little bit different, right? So what we do is we just do one round at a time. A lot of the studies that are done today with things like platelets and stem cells, they do multiple rounds on everybody. But we certainly get patients who get better with a lesser amount of injections, which really that's the end of the day. What we're going after is what your symptoms are. Every week someone will come back after they're feeling 100% and they say, well, we should look at the ultrasound again and see if we need another round of injections. And I discourage people from doing that, right? So just because we see something that's not perfect on an image, right, the pathology, it doesn't mean you're going to have symptoms. I know some of this stuff just sounds too good to be true, but we certainly have people walking around with really bad looking imaging, right? Really bad arthritis, big disc bulges, big rotator cuff tears, and they have no pain whatsoever. So something I like to do is if you come in for pain on one side of your body, right, I'll scan that. I'll show you what we're finding, and then I'll scan the other side, or the quote unquote, the good side, the side that has no symptoms. And very frequently, I will find things on the good side that looks worse than the side that's causing pain for somebody, right? So it's very, very important to understand that, you are not your imaging, right? The diagnosis that you get on your imaging does not always line up with what your symptoms are. And again, that's the important factor that I'm trying to figure out when a patient comes in for the first time. So we always ask you, leave that diagnosis at the door, keep an open mind, and let's see if there's another maybe cause of your pain we can put you in a position maybe with regenerative medicine to get you some healing. And again, avoiding the path of surgery. Every week I get someone who comes in and they're really upset and frustrated because they've had multiple surgeries. They were told one thing and now they're worse off than they were before. All the time they invested, maybe they're on pain medication now, maybe they're on, chronic anti-inflammatories, which we know, guys, this is not a great path to go down, right? These things have a lot of side effects. It's a very disruptive part of people's lives, obviously, with the opioid epidemic that we're seeing here with pain management, which again, certainly it's a powerful tool. Not saying you should never take pain medication, but what we're trying to avoid is the chronic pain medication. I don't want to have you be on a medication that you need to take the rest of your life just to get by, right? I'd much rather get to the key of it, right? Get to the source of your pain, get some healing cells in there, see if we can't get you in a position where we can get you maybe off of those medications, right? Lots of good side effects there that we want to try to avoid. Again, with the surgeries as well. Again, it's not 100% that you're going to have no complications, as opposed to what we're doing with regenerative medicine. Complication rate is very low, right? Really what you're looking at is going to be something like some stiffness and soreness for a couple of days, certainly. So that's just the nature of using aimed injections versus using a surgery. So we have the benefit of really limiting our patients to exposing themselves to those sort of complication rates. But really good stuff with regenerative medicine compared to some of these other options that are out there. Lots of great information we can give you too. Again, give us a call. Give us a shout here live in the studio. Love to chat about your case. You can give us a call, 866-870-5752. That number to call us live in the studio, 866-870-5752. We'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great place to start. Educate yourself. Great cases in there. Great science behind that. We get close to, 300 studies in that book now, really pointing out this new wave of medicine that's coming through, trying to keep people out of the operating room and get them to heal naturally, right? So we can give you a free copy of that book. We even pay the postage for you on that one. If you want to get a free consultation with our staff over the phone, give us a call, 800-300-9300. That's 800-300-9300. You want to see some videos of us doing these procedures, you want to get really deep into the research of regenerative medicine, check out our website. It's fantastic. We're at www.jointrehab.com. That's www.jointrehab.com. So we got a fun case to discuss here today with you. I had a young gentleman, I think he was in his 40s, coming in this week, and he was scheduled for neck surgery, and he also had another consultation where he was scheduled for shoulder surgery, right? So he was having some kind of vague pain. Sometimes it was in his neck, sometimes it was near his shoulder. And on imaging, what did they find? They had some degenerative discs. He had a disc bulge, right? And he had a partial rotator cuff tear. Right, so multiple pathologies that you're seeing on the imaging. We brought him in, did a physical exam. What I found was it wasn't really coming from, a disc issue. It wasn't really coming from the shoulder. What it was really just a muscle issue, muscle called the levator scapula. What that is a muscle that connects the neck bones kind of laterally or outside to the side to the shoulder. It's a muscle that kind of allows you to help kind of shrug and bring those shoulder blades retracted or closer towards the spine, right? And again, the mechanisms of the injury made total sense. He was doing some deadlifting, again, most likely overdid it. He was doing a little more weight than he's used to. Felt a real sharp pain right over that muscle. And it didn't surprise me. I asked him the question, hey, did these surgeons who gave you the recommendation to have surgery, did they put hands on you? And his answer was no, unfortunately. So you come in, I put hands on you. It was within about 2 minutes. We identified what that problem was. Nothing that you need surgery for, certainly. We ended up going the stem cell route with him. We just had our follow-up appointment with him, and he's doing fantastic now. And again, using ultrasound, I can be very specific where I place that needle. Anything on the backside, right, or on that chest wall, you got to be careful. You don't want to be burying a needle into a lung or anything like that. So we can visualize the entire time with ultrasound and being as safe as we can. Couple of pokes, you're walking out of the clinic. We just have him hold off on deadlifts for a couple of weeks, come back, and this is a gentleman who healed up right away. But again, it just gets back to that foundation of, does your pathology on your imaging line up with your actual symptoms? And so this is somebody that surgery, right, neck and shoulder, I don't think that would have got him any relief, right? So making sure we're being specific with our diagnosis. We're coming up to the break here, guys. Again, give us a call live in the studio, 866-870-5752. Free consultation with our staff over the phone, 800-300-9300. And our website, www.jointrehab.com. We'll see you after the break.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.